Here's the truth: nearly 1 in 6 couples worldwide, 1 in 6, struggle with infertility. That's not a small number. Hey everyone, Dr. Osgood here with GrassRoots Functional Medicine. I wanted to take a minute and discuss something that I feel doesn't really get enough attention, and that is fertility. Now, for so many couples today, fertility feels more like winning a lottery ticket. You do all the things, you follow all the protocols, and you wait, but month after month, nothing seems to change. Here's the truth: nearly 1 in 6 couples worldwide struggle with infertility. That's not a small number. And in the United States, the average round of IVF will cost a couple between $15,000 and $20,000 per attempt. And many people go through multiple rounds with success rates still hovering between 20 and 40% per cycle. It's not very good and it's extremely expensive. And that's not even the full story. Research shows that global sperm counts have dropped more than 50% since the 1970s, and that can't be a fluke. It's a health crisis. We're spending billions trying to force conception through invasive procedures while ignoring what the body is actually trying to say. Fertility isn't broken, it's responding to an environment that's out of balance. If your only tools are a speculum and a syringe, every problem looks like a procedure. Now, don't get me wrong, IVF and IUI can be incredible technologies, and they've helped millions of families, but far too often I feel like they're used as a first line treatment instead of a last resort. Women are pumped full of synthetic hormones, eggs are harvested, embryos implanted, and no one ever asks the important question: why can't the body just conceive naturally in the first place? The conventional system treats infertility like a mechanical failure, when in reality, it's a message. It's your body's way of saying something deeper is going on. Now, in functional medicine, we see fertility a little different. We see it as a reflection of overall health. It's not just what's happening in your ovaries or with your hormones. The body is brilliantly designed to survive. And when it senses danger or scarcity or inflammation or even too much stress, reproduction is one of the first systems to shut down. That's not broken biology, that is intelligent biology, and we need to listen. So instead of trying to override that with more drugs or procedures, we focus on creating an internal environment that's so healthy, that's so resilient, that fertility becomes the natural outcome. So let's talk about what that actually looks like. One of the biggest pieces is nutrition and a process called methylation. Now, most doctors tell women to take folic acid when trying to conceive. But here's the problem: folic acid is the synthetic form of vitamin B9. Your body has to convert it into the active form, methylfolate, before it can actually use it. And up to 40% of women have a genetic variant called MTHFR that limits this conversion. So instead of helping, that folic acid actually builds up and your methylation system just crashes. This increases risk for infertility, miscarriage, and even birth defects. This is a simple test. So, yes, the form of folate actually does matter. Through proper testing, we can identify these variants and use the right forms of methylated folate along with methylated B12 and B6 and choline and magnesium and other things to optimize your infertility pathways. We've been given women the wrong form of folate for decades and wondering why pregnancy rates keep dropping. Now, there are other factors. Another huge factor is stress. This one's a little tougher. You've probably heard stories about couples who try everything, they finally give up, they adopt a baby, and lo and behold, they're pregnant naturally weeks later. That's not luck, that's just balancing physiology. When cortisol, your main stress hormone, stays high, stress derails your other hormones like progesterone. Without progesterone, ovulation and implantation suffer. That's why adrenal testing is a game changer when it comes to fertility. We use various tests, salivary and urinary cortisol mapping, to see if your body is stuck in that fight or flight mode all day long. And if it is, that needs to be fixed before we can expect your body to carry new life. And then there's the concept of hormonal balance. Your hormones are like the conductors of a symphony. If one instrument is out of tune, the whole thing sounds off. Low progesterone increases miscarriage risk. Estrogen dominance causes inflammation and makes implantation harder. Insulin resistance and PCOS can stop ovulation altogether. Even high prolactin, which is often overlooked, can block ovulation completely. Now, many conventional doctors might check a couple of these hormones. Maybe they'll look at your estradiol or your FSH, but rarely do they look at the full hormone panel. In functional medicine, we like to dig deeper. We want to look at total and free hormones. We want to evaluate ratios and how they interact. And then there's the topic of toxins. Now, we're surrounded by endocrine disruptors, plastics, pesticides, cleaning products, personal care items. These are all loaded with compounds that mimic estrogen and throw off your hormonal balance. Studies show it's very clear that chemicals like BPA and phthalates can reduce fertility and increase miscarriage risk. And you can't IVF your way out of a toxic environment. Simple swaps like glass and stainless steel over plastic can make a huge difference. Clean up your skincare products, your household cleaners. They go organic when possible. The cleaner your environment, the clearer your hormonal communication. Now, here's one of my favorite topics. You probably know if you've listened to anything I've talked about, but it's the gut and the vaginal microbiome. This is where the research is absolutely exploding and where conventional fertility medicine is honestly 10 years behind. Your gut microbiome affects hormonal metabolism. It affects inflammation. It affects nutrient absorption. And if it's imbalanced, it can recirculate estrogen and trigger various autoimmune reactions that block conception. And then there's the vaginal microbiome. This is a new and up and coming theme, and it might be even more powerful. A healthy vaginal ecosystem dominated by beneficial bugs like lactobacillus protects against pathogens, supports sperm survival, and it helps with implantation. At GrassRoots, we use microbiome labs, which has a really cool vaginal microbiome test to identify and correct these imbalances. And when we do, fertility will often follow naturally. It's not uncommon to see that. Another factor we see is autoimmunity. Research shows that up to 20% of women with unexplained infertility have autoimmune antibodies that can attack various aspects of their body and interfere with fertility. That's why we test for antibodies. They do matter. We look at your thyroid antibodies, we look for ovarian antibodies, antiphospholipid antibodies. You can't fix what you can't find. And then finally, there's the concept of male fertility. About half of infertility cases involve a male factor, and sperm counts have dropped more than 50% in the last 5 decades. 50%. Toxins, insulin resistance, poor sleep, nutrient deficiencies, all of these things play a role. Testing semen quality, things like count, motility, and DNA integrity, give us critical insights. And the good news is that nutrients like zinc and CoQ10, vitamin C, L-carnitine, these have all been shown to improve sperm quality. Men deserve the same level of attention that women get in this conversation. You can't forget about the man. Now, when it comes to testing, most fertility workups are bare bones. They're very minimal. Maybe they look at an ultrasound, FSH, LH, and you're lucky if you get a TSH. In our practice, that's just a starting point. We evaluate hormones, we look at methylation pathways, we look at metabolic health, inflammation, autoimmunity, the microbiome in the gut and the vagina, and we do adrenal testing, among many other things. It's an ecosystem and everything is connected. You can't fix what you don't measure. So let me give you an example. Now, one of our patients came to GrassRoots after years, and we have several just like this with unexplained infertility. She was young, and this was really her primary goal. She'd done 3 rounds of IVF, had 2 miscarriages, and was just exhausted emotionally and physically. Now, we ran a functional workup. We did the whole battery of tests. We found insulin resistance. We found MTHFR variants. We saw that she had vaginal dysbiosis and low progesterone. We supported her methylation pathways. We balanced her blood sugar, optimized her progesterone levels, restored healthy lactobacillus in her biome. And lo and behold, 4 months later, she conceived naturally and carried the baby to full term. This is not luck. This is just simply balancing biology. Now, don't get me wrong. Again, I'm not trying to say IVF is bad. I'm not against it. It's a miracle in the right instance. But for most couples, the conversation jumps straight to these procedures instead of looking at physiology. At GrassRoots, we take a different approach. We see fertility for what it really is, a reflection of whole body health. We focus on detoxification, gut balance and repair, working on the adrenals, harmonizing the hormones, and cellular resistance. Once these things come into alignment, the body will do what it's supposed to do. It'll create life. Fertility isn't just a reproductive problem, it's a metabolic problem, it's an immune problem, it's an inflammatory problem that shows up in the ovaries. If you're ready to uncover what's actually standing between you and conception, start with our women's wellness experience. It's a deep dive. It looks beyond symptoms to help you identify some of these obstacles that may be interfering with fertility. And if you want a more comprehensive approach, look at our adaptation programs. When you stop guessing and you start testing, that's when the magic happens. Fertility isn't luck, it's physiology. When you remove the blocks, the toxins, the inflammation, you optimize nutrient deficiencies and you tackle the stressors, the body remembers how to create life. We've been doing it for many, many years. It can happen for you. At Grassroots, we don't just help people get pregnant, we help them reclaim the vitality and the balance that make fertility possible in the first place. Thank you guys for watching. Stay positive, stay hopeful, do the work, and that's where good things happen.